the past 15 years, I've treated patients with hand conditions. So I'm now a UK accredited hand therapist, and this is an area where I treat numerous hand conditions. They can vary from basic osteoarthritis of joints such as fingers or thumbs to what we call acquired conditions, repetitive strain injuries down the side of tendon inflammations, anything regarding the hands. If somebody presented with osteoarthritis at the base of the thumb, this is a very common condition, particularly in women past 45 plus age group. They find it very difficult due to pain to open jars, bottle tops, look after themselves, do fine jewellery, because pain will limit movement of the thumb. So my job would be to look at ways to maximise hand function, and that can be as simple as looking at exercise, so that builds up strength and improves movement, or we can look at devices that can help stabilise and support a painful joint, and this would be something like a splint. I would always, when I see patients, find out what they need to do with their hands, because obviously some splints are more rigid than others. They would be activity-based, some are completely inappropriate for certain activities. So it's knowing when and why they should wear it as equally as providing the splint for that patient to be as important. But patients who give splints, I would say 90% find them very useful, especially in the early stages of the condition. And then if they don't work, we can look at alternative treatments. So it's not a case of yes or no answers, it's what works for the time. I think Circle does something that's so unique in the fact that it follows the patient through its journey. And I think Circle is the right way of describing it, because we start with a referral, we see that patient and we follow them through that journey. We don't just have one little part to play in their role. We are the instigators to their entire treatment plan, and I think that's very unique and quite a privileged place to be as a clinician, to see a patient walk into your clinic room who for years has lived or suffered with pain, and then to be able to actually do something positive to improve their quality of life, I think is quite a unique situation to be in.